How's it going? My name is Jacob. Today I'm gonna go over the kinesiology final project. Starting off with bony structures and articulations of the pelvis and hip. I see on the left is the a picture of kind of the makeup of a hip. You see the femoral head and then the hip labrum essentially, which helps with function with the hip. The blue image, the ligament of head of the femur, which helps with movement, can help with rotation in the hip, internal, external rotation. Um, and then moving on to the Q angle, we see in the Q angle for females, it's actually wider, so it's um, more at an angle, as you can see, leading to wider hips, which causes an increase in the Q angle. And then the pelvis anatomy. See the ilium, which is the top part of the pelvis, kind of holding near the gluteus maximus. The sacrum, which is the middle part. The pubis, which is um, the lower part of the pelvis, and then the iliac crest, which is the top bony structure of the pelvis. Now looking at hip flexion and extension anatomy. Um, so For hip flexion, these muscles are included are the iliacus, the rectus femoris, the tensor fascia, and the sartorius. For hip extension, these muscles include the gluteus maximus, hamstrings, semitendinosus, and the semimembranosus. And then as seen on the bottom, movements of hip extension, moving the hip back, and hip flexion, moving the hip forward. And you see a better angle there. Hip extension shows at 0 degrees, and flexion, um, moving towards your chin essentially, or towards your chest. That would be hip extension and flexion. Looking at hip abduction and adduction, hip adduction muscles include the pectineus, the gracilis, and the hip abductors or adductors. And range of motion for adduction includes 35 degrees. Looking at hip abduction, these muscles include the gluteus medius, the gluteus minimus, and the sartorius. And range of motion includes 45 degrees. Kind of reviewing abduction would be away from the midline of the body, and adduction would be towards the midline of the body as seen. So moving the hips away from the body would be hip abduction. Moving your hips towards the midline would be hip adduction. Now looking at hip internal and external rotation. Similar to abduction and adduction, hip internal rotation, um, the hip moves inward, forcing the knee to essentially move outward, and or the knee to essentially cave in with your foot going outward, and then hip external rotation would be the opposite. So hip internal rotation range of motion would be 30 to 40 degrees. These muscles include gluteus medius, gluteus minimus, tensor fascia, and the hip external rotation range of motion includes 40 to 60 degrees. And these muscles include the gluteus maximus, sartorius, and the deep rotator muscles. So looking at the knee, the bony structures of the knee. So these bones are the femur, tibia, and patella. These ligaments include the cruciate ligaments, which cross within the joint cavity between the femur and tibia. They also ensure posterior anterior stability in the knee. Collateral ligaments connect femur with leg bones, aid and stabilize the knee. And then the main joints of the knee include the tibiofemoral joint, which is the primary joint of the knee. It is a hinge joint, which allows flexion and extension of the knee. The menisci, which allows better stability, better distribution of joint pressure, provides joint lubrication. And lastly, the patellofemoral joint, um, which is in relation with the Q angle, um, which a normal Q angle in females is 18 degrees and 13 degrees in men. Looking at knee flexion and extension, flexion range of motion would be 135 to 150 degrees, and then extension would be 0 to 10. And then exercising including would be like quad extensions for extension, hamstring curls for flexion as seen. Flexion would be moving towards the glutes, extension would be moving away from the chest. Now looking at the ankle, the foot. So the structure of the ankle has 26 articular bones contained in three functional units: the forefoot, midfoot, and hindfoot. The forefoot, which includes the five metatarsals, one for each digit, which would be the toes. There's 14 toe bones, three each for digits, two to four, and two for the grade two. The midfoot is composed of five tarsal bones, the navicular, a cuboid, and three cuneiforms. And then lastly, the hindfoot, which would be the back of the foot, is composed of the talus bone and calcaneus bone. There are approximately 100 ligaments in the ankle and foot region, anterior and posterior talofibular and calcaneofibular ligaments. Looking at the image on the bottom left, just looking at pronation. Normal pronation, the feet roll 15% inward. Over pronation, the feet roll more than 15% inward. And then under pronation, the feet roll less than 15% inward. And then to the right, just the makeup of the ankle joint. So looking at ankle dorsiflexion, plantar flexion. So dorsiflexion is toes to the sky, and plantar flexion is toes to the ground. Just some images. Inversion would be the ankle moving inward, and inversion would be the ankle moving outward. So a high ankle sprain would be an eversion movement, um, and then dorsiflexion, plantar flexion, which usually are causes of calf strains or Achilles injuries, just depending on the way the ankle moves. And then to the right there, the main dorsiflexors for dorsiflexion are the tibialis posterior, the flexor digitorum longus, the gastrocnemius, and the soleus. And then the main plantar flexors are the tibialis anterior, extensor hallucis longus, and the extensor digitorum longus. Lastly, looking at the cervical and lumbar spine, five spinal regions, which are cervical, thoracic, lumbar, sacral, and coccygeal. I don't know how to say the word. Normal curvatures include cervical and lumbar lordosis, and thoracic and kyphosis. And then there are 24 individual vertebrae, seven in which are cervical, 12 which are thoracic, and five which are lumbar. Cervical would be the neck, thoracic would be the mid back, and lumbar is the lower back. And then looking at the ribs, ribs attached to each of the 12 thoracic vertebrae bilaterally and form the thoracic cage. There are seven true ribs and five lower pairs of ribs, in which are considered false, three attached to the sternum, and two are considered floating ribs. As seen in the diagram below, there are ribs and then the two bottom floating ribs, which aren't connected to anything, and the false ribs, which are uh, the three in which attached to the sternum.